Some members of the Nebraska Legislature have worked to limit the authority of health directors across the state.
This is LB 203, and it would require a vote of elected officials before a directed health measure would take effect.
For some doctors, that bill is cause for concern. First Alert 6's John Chapman explains.
Public health directors got the attention of politicians in Nebraska during the COVID-19 pandemic. Health directors issued mask mandates, they say, to protect the public from the virus, suggested restrictions on the number of people gathering in one place, affected school attendance, and made suggestions on how far we should stand away from each other. Nebraska State Senator Kathleen Kauth introduced LB 203, the senator testifying last year that health directors hold enormous power over individual liberties during the pandemic. LB 203 would change that.
It means that only elected officials should have the ability to restrict those liberties. They are directly responsible to the citizens who elect them. Should those citizens feel a decision is not in their best interest, the elected officials will face an accounting at the ballot box.
A health director is probably going to err on the side of safety and be more restrictive.
Dr. John Peters is a past president of the Metro Omaha Medical Society. Dr. Peters says decisions made by local governments may not match up with decisions made by governments beyond their borders.
So if a city, a county, etc., wants to do something different than the rest of the region, when those individuals travel, go about, interact with other people, and it's a communicable disease situation, even though they're making a decision locally that may be favored by the majority, there are consequences when they interact with others who are not in accordance with that.
Right now, the federal government is causing confusion among patients, with regulators and officials saying one thing and doctors saying another, especially about vaccinations.
But just the confusion will stop people sometimes from seeking the care, getting the vaccination, and therefore if they succumb to the disease and transfer it to other people, we have a lot of problems that didn't need to happen in the first place. And so I find that irresponsible to be spreading that misinformation. That's very unfortunate.
Dr. Peters says it's important for patients and doctors to respectfully discuss with politicians about how government decisions affect health care, how they pay for health care, how doctors are reimbursed for health care, and who is making decisions about their health care.
To get from A to Z, to see the patient and to provide the care, there's a lot in the middle. And with a lot of roadblocks and obstacles that don't need to be there, that's very problematic for physicians.
In Omaha, I'm John Chapman, First Alert 6.
Dr. Peters believes it's a good idea for patients to educate themselves about their health care and get information from a number of reliable sources.